Hi guys, so in this video I will discuss about the effects of estrogen and progesterone on female genital tract. Now if this concept gets clear, so it will help us when we will discuss about the effects of or the uses and indications, contraindications of contraceptive pills, right? So in this session we will look on this topic, and it is also important because it has been asked, right? So let's see. So I will make a table of organs and the effects of estrogen and progesterone, correct? So let's take first breast. So in breast, estrogen actually supports the ductal, or we can say stromal growth, ductal or stromal growth. On the other hand, progesterone supports alveolar growth, right? So this is an important question and has been asked, right? So breast. So in breast, the estrogen supports ductal or stromal growth and progesterone supports alveolar growth. In vagina, the estrogen, what it does, it promotes the superficial cells with glycogen, and progesterone supports the intermediate cells. We will discuss these cells briefly in another session. Actually there are three cells: superficial, parabasal, intermediate cells. And just remember that estrogen supports the superficial cells, progesterone supports the intermediate cells, right? Now talking about cervix. Now what changes estrogen make in cervix is that estrogen makes abundant mucus, right? Thin mucus is thin, viscous, and penetrable to sperms. Penetrable, right? Whereas under the effect of progesterone, cervical mucus is thick cervical mucus, so it is impenetrable to sperms, right? Talking about endometrium, under the effect of estrogen there is proliferation, of course, proliferation of blood vessels, etc., right? And under the effect of progesterone there is secretion, mainly of glandular type, right? Talking about fallopian tube, under the effect of estrogen there is secretion, and under the effect of progesterone there is increased peristalsis, peristaltic movements, right? You can say it is better, peristaltic movements, increased peristaltic movements. So this is about your fallopian tube. And talking about ovary, under the effect of estrogen actually there is no effect, and progesterone also has the same, no effect, right? So we will revise this one and we will apply this in your contraceptive section, right? So I will mark the important ones. Yes, this is important. So in breast, estrogen supports ductal or stromal growth, whereas progesterone supports the alveolar growth. In vagina, estrogen supports the superficial cells, whereas the progesterone supports the intermediate cells, right? In cervix there is thin mucus which is abundant, viscous and penetrable to sperms under the effect of estrogen. Under the effect of progesterone, the cervical mucus is thick and impenetrable. Endometrium, under the effect of estrogen there is proliferation, and under the effect of progesterone there is secretion effects, right? Secretory effects, right? In a fallopian tube, under the effect of estrogen there is secretion, and under the effect of progesterone there is increased peristaltic movements, and ovary has no effects under both estrogen and progesterone, absolutely no effects. So I will conclude here, right? Thank you.